Hey all, good morning and welcome to ShareTreck. This is a one-off video again. I'm highlighting a new startup company that has just emerged out of stealth, and it's in an exciting new area. Again, inherited genetic disease. So if you're curious, continue watching. Let's get started. Hey all, welcome back. This is Raj here. Our topic today is hereditary hemorrhagic telangiectasia. I may not have pronounced it right because I'm not a scientist, but let us use the short form HHT to address this hereditary condition. A new startup has emerged to address this particular condition, and today it has come out of stealth. And I think we are among the first channels to probably bring out this news to you. Let's talk a little bit about what HHT is. Men, women, and children from all racial and ethnic groups can be affected by HHT and experience problems associated with the disorder, some of which are serious and potentially life-threatening. Presently, HHT is uncurable. Here is what happens to patients with HHT. HHT is a disorder in which some blood vessels do not develop properly. A person with HHT may form blood vessels without the capillaries, which are those tiny blood vessels that pass through that pass blood through from arteries to veins that are usually present between arteries and veins. The space between an artery and a vein is often fragile and can burst and bleed more easily than other blood vessels. Right now, the diagnostics can be done using genetic testing. Genetic testing can detect a gene mutation in about 3/4 of families with signs of HHT, which, if found, can establish the diagnosis of HHT in individuals and families who are unsure about whether they have HHT. HHT can also be diagnosed by using clinical criteria, that is, presence of signs and history of signs in a parent, sibling, or child. So if any of the parents have got HHT, then normally you'll have to screen the progeny in order to see if they have any mutation for HHT. We already have genomic diagnostic companies which are offering diagnostic service. So step one of diagnosis in a very definitive manner is already achieved. Now let us look at treatment options. Current treatments consist of controlling bleeding and anemia and preventing complications from abnormal artery vein connections in lungs and brain, because those are two key organs where if things go wrong, it could be fatal. HHT is a genetic disorder. Each person with HHT has one gene that is altered, that is causing the HHT, as well as one normal gene. So it takes only one gene with a mutation to cause HHT. When someone with HHT has children, each child has a 50% chance to receive the gene with a mutation from his or her parent, and therefore to have HHT as well. Each child also has a 50% chance to receive the normal gene and not be affected by HHT, so that's the good part of it. At least 5 different genes can cause HHT, 3 of which are known. I have not yet found information online if base editing could be used to target this condition. However, a new startup with a great pedigree is attempting to address HTT, and I don't think they are using base editing or CRISPR to solve this issue. The origin story of this new startup goes back to 2017, when 2 Novartis clinicians, Pierre Saint-Mazard and Damien Picard, both approached Nicolas Benedict, who's an alumni of Novartis, who left Novartis probably in 2007, and since then had headed a series of biotech startups. So his experience with handling startup was what attracted them to Nicolas. They proposed the idea of using AKT inhibitors, typically used to treat cancers from rare diseases that cause blood vessel malformation. The 3 of them founded Vaderis Therapeutics in 2019 out of Basel in Switzerland with $19 million as backing from Medici Ventures. And they are launching from stealth today as they take their idea now in drug form into clinic for 80-patient proof of concept study. Vaderis will begin a clinical trial to test the safety of its drug dubbed VAD044 in 80 patients across the US, Canada, and Europe. Benedict says that the biotech has enough funding to see it through the clinical trial, which is set to read out in 2024. Now, let us have a quick look at the website for this new company and also at the pipeline. As you can see here, we have the website of Vaderis Pharmaceuticals out here in the browser. And let me go to the home page first. So basically, it says Vaderis is a clinical stage biotechnology company focused on the treatment of rare and orphan diseases caused by vascular malformation. So it's a broad category, and one of them is HHT. Now, if you look at the leadership team out here, you can see the pictures of these gentlemen that I was talking about: Nicholas Benedict, Pierre Saint-Mazard, and Damien Picard. So these were the three people who got together and started this company. And if you look at the pipeline, we can see that VAD044 for targeting HHT is in phase 1B of clinical trials. So it's the most advanced of their therapies. The same therapy is being used for VLM, venous and lymphatic malformation, but that's in phase 1A of the clinical trials. And there is also one more first-in-class candidate out here called novel MOA for vascular malformation that's in preclinical stage. So this is a very interesting company to keep track of. As I mentioned earlier, I don't know if this condition can be addressed with base editing, but I'm pretty sure that Beam and Verve are going to take good notice of what is happening out here, and potentially they may also have a item introduced into their pipeline, a new candidate to address HHT, if they have not already thought about it. At least that's what I'm thinking. Friends, that brings me to an end of this video. As always, if you like this video, please put a like out there. It helps the channel get new viewers. And also, if you have not yet subscribed and you have been watching our videos, please subscribe and help us grow this channel and continue bringing you new thought-provoking videos and more information on the genomic sector in general. Thanks and have a great day. Bye for now.